with that, with all of those introductions, I am going to turn it over to Bruce.
Wow, my turn?
Yes, it's your turn. Go ahead.
All right, let's do this. I was really, I got to say, pleasantly surprised, I think, by the second poll that we did, that there is such a mix of people that are sort of familiar with this kind of reporting. It's a little nerve-wracking because, as you'll see on my first slide, I'm going to refer to myself as new guy from here on in. And so some of you might be one chapter ahead of me in the textbook, but if you are, chime in and tell me if you think I've gone astray anywhere. So I think my piece of the puzzle today is to sort of give you that new guy perspective, sort of someone who's new to the business but is on the inside and pretty heavily involved in doing some of this sort of thing. I was also pleasantly surprised to see how many people weren't medical officers of health. No offense to the medical officers of health that are listening. Don't give me grief in the chat box, but I feel like you guys are my people. So it's good to be in a room with a little bit of backup. Just as a very small snippet, I live in a pretty cold place, Thompson, Manitoba. That picture, I'm obliged to show you a picture of me being cold. So that was mid-November. I have the same picture today, minus 33 on my walk to work. So it was fresh, but we're civilized too. And the picture on the other side is just me presenting to a Families First conference a little while ago about some health promotion and sort of public health stuff. So yeah, in many respects with compiling the community health assessment, that's what I'm going to talk about today. That's part of my role. If you're more familiar with the term health status report, it's pretty similar. So as the new guy in this sort of world, what I'm going to do in the next few minutes is just sort of try to outline some of the challenges that I've seen with compiling and sharing what I'm going to call it a community health assessment from here on in. Dianne sort of touched on a little bit of this. Where am I coming from? Who's the guy on the other end of the phone? I sort of fell into this position of compiling our community health assessment more than went after it. So we had some organizational changes, and one thing led to another, and I was a decision support analyst. I'm not an EPI, and I'm sort of a wannabe media guy in my not real life. I like to do that sort of thing. Some of my background also is in health promotion, recreation, community development, and so the other obligatory bike picture, because I bike 12 months of the year, and I lead our active transportation committee. So public health and population health and those things are a big part of my background and sort of what I care about, and that fits right into community health assessments in a lot of regards, because we're trying to just sort of move the population forward. And in an interesting sort of turn of events, I think being a radio guy, media guy, somebody who's interested in writing and graphic representation is an interesting fit for this position, because it isn't just about numbers. It's about sort of translating those numbers and making them into something that people like and that they can sort of connect with. And so I think I have kind of an interesting fit with this job. Even though I'm not an EPI or like a data nerd, and I say that with love. If you're a data nerd, we're embracing that term. I'm one of those people. I did do a couple years of engineering at Recreation, so numbers don't scare me too much. A little bit sometimes, but not too much. So the title of this slide, Hey New Guy, you got the CHA. So I take this job as a decision support analyst with our region. Pretty exciting thing. Basically, day one, my supervisor came in and said, okay, half of your job is going to be putting together a community health assessment for our region. We do one every 5 years. That's a standard in Manitoba. Each of the regions has to do one. This is your baby. The last one was 600 pages. And I said, whoa, okay. I wasn't super familiar with community health assessments. When I first came into it, I had used it a little bit in my health promotion role, but hadn't really dug into it too much and had never really been a part of compiling one. So some of the things that I discovered right away was that they're very rarely dog-eared, not very well used. When I came into the position, 3 different people came and gave me their most recent copy and said, oh, you're new to the position here, you might need this, and they all look like they had never been touched. So that breaks my heart a little bit on the project I'm working on now. What I also discovered was at times it can be pretty intimidating. So it's a big, heavy document. There's lots of text, some complex tables. It looks a little bit more like an encyclopedia than Twitter, and I'm more used to Twitter than encyclopedias. It's also written for a real wide variety of audiences. So when you go through it, I really felt like we're trying to reach the public. We have a little bit in there for them, something for staff, things for medical officers of health. Hey, I shouted you guys out even though there aren't many. Our board of directors, things like that. And so a part of the challenge with having people adopt the CHA, I think, was having it kind of mean something to them. So as soon as it got handed to me, I thought, hey, we have some challenges and maybe some opportunities with doing another one as we move forward and making the new one maybe just a little bit more engaging, and that's no slam on the people that made the one before me. One other miniature little sidebar, I sometimes wonder if when we call things an assessment, that right in the title we lose people. I think there's a negative, there shouldn't be, but there's a little bit of a negative connotation that goes with assessment. If you got assessed in school on your report card, if you're going to the doctor for an assessment, oftentimes that doesn't come with happy news. Some of the people look forward to a report card, but not everybody does. And so sometimes I think we're behind the 8 ball just a little bit, even when we start by calling it an assessment. I got a polling question. I'm not on the tech end of this, but hey, look at that. It just showed up. Quickly, what describes your current community health assessment report? Doorstop or dog-eared? It was looking good dog-eared for a little while.
It's a race.
It's a race. This is looking pretty good. I almost wonder, are you guys just gaming the system so that it's an exciting finish? I had a lot of money on doorstop, and I'm losing ground here.
No, I think doorstop wins.
Doorstop wins, but not much.
Look at that. No, I almost don't want to close it, but I will.
Yeah.
Thank you, everyone.
Let's close it off. That really warms my heart, especially as a person who's going to be compiling a whole bunch of a community health assessment. A couple of the challenges I think that I feel like I've run into and that we do with lots of this community health reporting, especially some of these bigger, longer reports that cover a lot of time, is how do we show a balance between having something as a repository, so where we've got all of this information that somebody can kind of dig into and look for a gem, versus showing some meaning. And so if our board of directors opens it up, sometimes I think what they want to see is something that says, now we have to work on this initiative. You know, all of a sudden diabetes is a problem in our region, so we should dig into that. And it's really hard, I think, to make a balance between how much of that is just a repository and a bunch of information versus something where we are guiding people just a little bit more. So it's a tough one because you don't know what you don't know. And so I think people hope to do a bunch of research and compile a bunch of data and then have these epiphanies jump out of them. But another part of doing this kind of reporting is showing long-term things. So we want to see where our smoking rates have gone over the last 30 years. I hope that kind of makes sense. But for me, as we put it together, I find that's a real sort of tightrope. See the picture? That's not me, actually. It's a guy that I want to be someday. It's on my bucket list. And as we're putting it together and trying to decide what should be in the report and what data we're going to collect, it's hard to have a crystal ball and say, we see that there's going to be a meth problem in 5 years, so now we should start collecting data on meth, or should we be collecting drug data starting now, just hoping that nothing bad happens or that maybe we'll be looking for it. So I really feel like there's a tightrope in terms of what we should be collecting and putting in there and just how much we actually interpret it and try to show some of the results. And we'll talk about that. Katrina will especially talk about how we share the results once we've started to collect these and done some bigger reports. But the other one that I find is that we have a wide audience and a wide skill gap in terms of interpreting different forms of data. So what do we have in there and how do we show it? to make it relevant to some different people. Here's one that happened to me in the last couple of years. I think when I got there, does everyone know what Stockholm Syndrome is? It's when you get captured by somebody and then after a while you start to kind of sympathize with them. So I don't want to make it sound like the data nerds of Manitoba captured me, but I'm definitely in the circle. And the graph that you see on your screen is one of the ones that's pretty common in Manitoba reports. And the first time I looked at it, it was like I had to take a knee, right? There's a lot going on there. And it's incredible. There's a ton of good information. So over time, I understood how to interpret this graph, and now I look at these graphs and I understand the little pieces that you see on the right. Those are sort of community abbreviations, and there's the T1 and T2 for statistical differences and all of those kind of things. But when you first look at it, it's super overwhelming. And I think we have to be cognizant of that half of the people that are listening in today, and you guys are interested in this, so I'm guessing there's lots of people that aren't, that'll open up a CHA and see that and probably unplug or have to spend a lot of time understanding it. So we have to, as the people on the inside, have to realize that over time this all makes sense to us and it's easy, but we really have to understand our audience. And so I've got my little call to action at the bottom. Identify your audience and try to, as much as you can, tailor your report for them. The other little sidebar, and it's interesting, my wife's a teacher, and I think we can take a lesson from this. She said teachers are very, I don't want to stereotype, but generally very organized and like to do things in organized steps. Most learners don't. And so that's a bit of a disconnect for teachers, and I think we have to, in every profession and every piece of the world, have to watch out for that. But we have to think not so much about how we learn, but how does our audience learn and how do our learners learn. So the other little piece to this, when you see this, is once we get on the inside, and now that I've been indoctrinated by the data people, you get excited about how much data there is and how rich these graphs can be. But sometimes we overwhelm ourselves, but sometimes we overwhelm our audience too. So we have to just sort of give it to them bit by bit, I think, sometimes. Let's see. So here was the other one. Once you get into the job, I think there's lots of people that say, hey, new guy, we got to make those numbers exciting. And the way to do that is definitely through various media. And I thought just a pretty cool example of that. So I was helping some people in our office not too long ago. We were working on an Excel document, and there was something that we knew you could do with Excel, but none of us could figure out the steps to do it, which drop-down menu. And so we Googled it, of course. And when the search came up, there was a YouTube link, and then there was like a static web page. And me watching a YouTube video to see how to do an Excel thing was like nails on a chalkboard. It drove me crazy. The people I was with went instantly to the YouTube and said, there's no way I'm reading through this document. I want to watch it on YouTube and figure it out. They both had the answer. But I think that goes to show that as we try to transfer this data, or the message that we're trying to use is that various media resonates with different people. And I think up to now we haven't reached out very much to different interactive websites and different media and different sort of things like that. We don't even use interpretive dance anymore to share our results, and I don't see what's going on with that. But I think it's a challenge. I think part of what pushes that is just tradition. We do this time what we did last time, what we did the time before. Lack of time and money. Sometimes we do fall into a little bit of a repository mindset, I think. So sometimes we got to look for dancing bears and big flashy solutions, but that doesn't always mean that we transfer the data properly. And so some people want to see dancing bears and be entertained. Some people want a list of information. So find a format that speaks to the people, and then try to tailor your report to that. So use more than one form of media, and do your best to engage your audience. Here's the other one, new guy, me. I think I'm good at everything, but turns out perhaps I'm not. So again, I'm going to throw out some stereotypes. Try not to whammy me too hard in the chat box, but oftentimes the number people aren't super creative. And lots of times creative people aren't enamored by great big giant Excel spreadsheets. I fall a little bit on the creative side of the line, I think. And yeah, I'm generalizing, but that's just how it goes. So not everybody is great at all parts of knowledge translation, and you need somebody that understands the numbers and that can pick important pieces out of that, but you also need somebody who can make them sing a little bit and look good. And so partner with somebody who's good at other parts of knowledge translation. If you happen to be one of those special people that's good at both, still partner. More friends is better, more heads around the table, I think, always helps. So that's my other call to action. My last one is just a little pat on the back for my data nerd friends and the people in Manitoba. We have a community. This is a little bit of a, I think it's a best practice and pulls together a few of the things that we're talking about, but we have a community health assessment network. These guys absolutely saved my bacon. So like I said, when I took this job, I got handed the mandate to do our community health assessment and thought, holy man, I'm overwhelmed. It turns out that this time around, all of our regions in Manitoba, there's 5 regions, are working together. So we're developing a common template, and then we're going to plug in some of our regional numbers and a few regional stories, but we're also going to use some provincial stories and things. So it's turned into just an absolutely amazing collection of people. And in this respect, we have people from a few different places. So we have some like people with their papers as data nerds. There's some chart and graph people that love digging into making the charts and making the graphs readable and understandable and looking good and having all the pieces they should. We have a real designer. We have some people working on infographics. We have some other people that are just great at teasing out stories and telling them in an engaging way. And we're all working together. So it's I feel like it's a good news story, but it's not done yet. So check back with us in September of 2019 and cross your fingers that this cake gets baked as well as I hoped it would. It's going to be delicious. Dianne, I think that's my story. I hope I didn't talk too fast.
No, that was great. Thank you very, very much. I really appreciate that. You make some really, really good, practical, everyday kind of points that we might think about in conversation, but we don't necessarily think about when we're in our own office just at your computer or just in your own little space. So I really appreciate hearing that perspective.